How we allow for referrals is a big issue. So, one of the things that we need to consider then is looking at a national CHSDA, because it is another social justice issue. It's essentially the federal government recognizes we have a right to health care. But what they're telling us as Indian people, you don't have the right to live where you want to live. If you want health care, you go back where you belong. Is that constitutional? I mean, that's an issue of social justice and interstate commerce. But essentially, that's what the federal government is telling us as Indian people, and we put up with it. Maybe it's time we stop putting up with such ridiculous things. So we've heard it called many things. I've heard the Speaker of the House say it's a government takeover of healthcare. Nothing could be further from the truth. There's not even it's not a single payer, and there's no public option within it. Now, a public option would basically mean something that people could purchase into, like a federal employee health benefit or kind of a Medicare plan for everyone that you could purchase. But that's not even available within current legislation. It really is just health insurance reform. So there's some good provisions. We eliminated the pre-existing conditions component, so you can't be denied care because you were sick before you were in that insurance pool. It does pay for preventive services, including cancer screening. So there's some good things that are in it, but it certainly is not healthcare reform, and it's not what it's being billed as in terms of a government takeover. The most controversial component of it is the individual mandate. People have to purchase insurance, and if they don't, then there's a penalty for it. And there's been all kinds of discussion in Congress about repealing healthcare reform because of that. Now, ironically, the individual mandate in the early 1990s came out of the Heritage Foundation, which is a deeply conservative political action group, and they came up with the whole concept of the individual mandate. Personal responsibility. At one point it was a Republican idea, and now the Republicans are saying, well, now it's unconstitutional because the Democrats are moving it forward. So it's just really become just a political fight. It's not about truth, it's not about ideas, it's not about healthcare, it's about politics and power. And unfortunately, that's the circumstance that we're immersed in. And hopefully we can overcome some of these things, but it's going to have a big impact on whether or not this gets implemented. Yeah.
I thought that the Healthcare Improvement Act had some language in there about the individual mandate, where we as individuals, tribal members, don't have to be.
Yeah, no, that's a good point. With the individual mandate, as tribal members, we don't have that same mandate. We did get that exception. So as tribal members, we don't have to purchase insurance. We are exempted from that. But everyone else in the country is not exempted. They do have to purchase it. A couple of other things in terms of the healthcare legislation generally is that it does increase eligibility for Medicaid to 133% of poverty. And we have a lot of working poor people in our communities. And there are the state exchange programs that we can purchase into if we choose to. But you're right, historically, we haven't done as good of a job as we could at signing up for things like Medicaid and Medicare. But in truth, IHS is so terribly underfunded, we need to leverage those resources. And from my perspective, the treaties don't state that we have a right to health care from an agency called the Indian Health Service. We have a right to health care from the federal government. And whether it's Medicaid or Medicare or IHS, it doesn't matter. Those are federal dollars, and we need to participate in those plans to ensure that we get as many resources as possible. And in truth, our lives depend on it as tribal people. So we are exempted from the individual mandate. There's another opportunity within the Indian Healthcare Improvement Act in which tribes that have a 638 contract can purchase into the Federal Employee Health Benefits Plan. So you can actually purchase federal employee health benefits for your tribal members if you have a 638 contract. But again, exactly where this is going to go, we're not sure yet because of all of the political turmoil associated with it.
If that happened, would that CHSDA issue be resolved if you were purchasing a federal insurance program?
The question is, would the CHSDA issue be resolved? If you have insurance, you don't have a CHSDA issue.
Right.
Yeah, but if you don't have insurance, if a tribe can afford to do that, purchasing that insurance would be of great value. And then we would get over some of the issues like the CHSDA issue. I mean, you could live within South Dakota, but be far enough away from your home reservation that you're not eligible for a referral unless you go back to your home reservation. But if you have federal employee health benefits, you are. covered no matter where you live. Okay, well next question, who is insured? If you look at the private sector insurance industry, and again, the Affordable Care Act is health insurance reform, not truly health care reform. But the people who are insured are employed adults typically and their families. That's probably the most healthy demographic in this country, people who are actively working and their families. They're the ones who typically have private insurance. And last year there was an article on health insurers posting record profits. The 5 largest insurers had a $12.2 billion profit in 2009. That's 4 years of IHS funding, not in revenue, but just profit alone. Isn't that remarkable? 12.2 billion in profit. So healthcare is very profitable for certain sectors, again, the ones who have the most political clout. Unfortunately, we typically haven't had enough political clout historically to get the types of services that we need. So other people who are insured in the public sector, elderly, Medicare, impoverished, and disabled, Medicaid. There's also CHIP, the Children's Health Insurance Plan. Military veterans are eligible for Veterans Administration health care coverage. And American Indians and Alaska Natives is IHS insurance, and no, it is not. So the insurance provisions don't apply to IHS within the Affordable Care Act. So the insurance industry is covering the healthiest people, and the vast majority of people who need healthcare services are not covered by private sector insurance, which is part of why it makes it so profitable, unfortunately. Yeah. So what are more impacts on us? Well, it gets very complicated. Key provisions, no cost sharing for American Indians. So for example, if we have Medicaid or Medicare, we don't have to have a cost sharing component, so no co-pays, for example. So that's part of it. Coverage for preventive services, expanding Medicaid coverage, like I said, to 133% of poverty, and expanding federally qualified health centers, or the community health centers. So the way this would impact us depends on which delivery system we use. We call it the ITU system, right? IHS for IHS Direct. T is Tribal 638, U is Urban Indian Health Centers. So, for example, expanding federally qualified health centers, that would have an impact if we have more money for federally qualified health centers, because tribes and urban programs are eligible for those grants. The IHS is not eligible to become a community health center under HRSA. Now this gets into the weeds of the policy issues, but essentially if you're at a reservation that's an IHS Direct Services facility, that provision will have no impact. But if you're at a 638 facility or you go to an urban Indian health center, that provision could have an impact. So it depends on which delivery system you use, IHS, tribal, or urban, and it depends on your payer source. If you have no alternate resources and you're dependent on CHS, Contract Health Services, then that's not insurance, so there's no impact. But if you're American Indian and you have Medicaid or Medicare or you're privately insured, then it will have an impact. So the answer is, how will it affect Indians? The answer is, it depends. It depends on where you get your health care, and it depends on whether or not you have insurance. And it also is going to depend on whether or not this holds up in court. Right now, I'm not really worried about Congress repealing it because the president wouldn't sign it and they wouldn't be able to override a veto. But certainly, I think through the Supreme Court, they could potentially say that the individual mandate is not constitutional. And if they did that, then we would be in trouble. It wouldn't be implemented. Last slide is the following. I've worked in tribal advocacy for a number of years now, and what I was taught was that data drives policy, and what I've learned is that that's not true. We've had data for years that show we have disparities, and it still is not affecting policy. So data can inform policy, but in truth, it really is a black box theory of health policy, and it doesn't matter if it's a good idea or a bad idea. All that matters is who's driving it, which is very unfortunate. If you have a strong political champion, you can affect health policy. If you don't have a strong political champion, you can't. So whether we like it or not, we have to be involved politically, because that's what's going to make an impact on whether or not we get the services that we need. And I'll go ahead and end it there. Thank you all very much. you.